Hello, I'm Donal McCauley and welcome to medicsvoices.com, where we talk to the key opinion leaders in health and medicine around the world. Today I'm in Australia and I'm talking to Danielle Mazza. Danielle, tell me about your interest in medicine and where it began.
I really got into medicine because my father told me that I should. So I'm the eldest daughter of a migrant family to Australia, and my father used to drive me to my ballet classes, and he used to say, "Danny, you need to do medicine. You'd be really good. You need to do it because we weren't able to do it. You've got the opportunity. You've got to take advantage." So. He gave me good advice because it's turned out to be a great career.
I mean, that is the classic story, isn't it?
Yeah. Well, the only other funny part of the story is that in my family, my mother was one of 5 children, four girls and 1 boy, and my uncle became a renal physician. But all the women in my mother's siblings, her four female siblings, all became teachers. So when because as a woman you could either become a teacher or a nurse, not a doctor. And so when I became a doctor and then I went into academia, my grandmother said, "What are you doing? Why are you going into academia? You're trained to be a doctor. Why aren't you in clinical practice?" It was quite difficult to explain that I had also chosen, teaching and research.
So tell me about medical school and the things that interested you and what brought you into a career in family medicine.
Yeah. So look, I was interested by lots of things, but never really the technicalities of procedures and surgery and things like that. I really enjoyed the more the aspects of medicine that involved building relationships with patients, and general practice seemed to encompass so many of the things that I really enjoyed about clinical medicine and the breadth of it. And I think particularly that the continuity of care, but it was really the capacity to build relationships with people and to use that in a therapeutic way that was really so attractive.
Now, your major interest is in women's health, where you've done an enormous amount of work. So tell me about that development.
So I guess I had some kind of watershed moments in my training that really opened my eyes to issues in women's health. I found my obstetrics training very dogmatic and very lacking in evidence, and very focused on maternity care. At very little in terms of gynecology, and I went and did my elective at the London hospital with a doctor called Wendy Savage, and I'm not sure if you know about Wendy, but I had read a book that she had written that was about. She was an obstetrician working in the East End of London, and she had been, I can't remember the specifics now, but she had been kind of deregistered or, told by the hospital that she worked in that she wasn't able to practice because the way she practiced was unconventional. And her patients marched the streets to have her reinstated at the hospital. And so I wrote to her, I said, "I want to come and do my elective with you, Wendy." And she was a bit surprised. She kept asking me why I was there. I said, because all I hear is, all of this dogma, but you do things differently. I want to understand why. And she talked to me, I was very impressed by her commitment to working with disadvantaged women in the East End. Her patients were mainly Bangladeshi women, and she had also spent part of her career working in Africa. where there was a lot of maternal mortality and fetal mortality. You know, some of the things she did, late term abortions, you know, I watched her carry those out in her practice, and you know, I asked her lots of questions, and she told me about her commitment to women and putting women first, and how the impact of practicing in Africa had really influenced her in the way she worked. So she was really someone who made a really big impression on me. And I was also fortunate to be supervised at one point in my career by a fantastic psychiatrist, Lorraine Dennisteen, who worked in the area of women's health, in particularly in relation to menopause and mental health. And Lorraine was able to research and undertake practice in areas that were very stigmatized and not really talked about in my medical career to date. So both of those women made, you know, really big impact on me, and I think influenced my career direction a great deal.
But let me ask you about that a little bit further. So Wendy Savage was in the news. So then you wrote to her, or you knew she was a trailblazer and she became infamous after that?
I think all of that period in Wendy's career had passed, and it was being written about, and I had read a book about it. And so at that point, I wrote to her, and I thought, oh, she'd be really good to go and learn from. I've always been impressed by people who have challenged the status quo, and yeah, gravitated towards them, I think. So
are you someone who challenges the status quo?
I hope so. I hope so. Yeah, I really think that's the contribution that I want to make. I want to make change, and I want to improve things. And you know, when I went into clinical general practice, I tell my medical students when I teach them, you know, I felt like there was this tsunami of disease coming towards me, and I felt early on in my career, I felt quite helpless, that I was kind of dealing with things that could be prevented. And the more I learned about women's health, the more I learned about the socio-demographic impact of women's lives on their health. And so it's really, you know, determined, again, my career path. I've done a lot of work in preventive care, and I've been chairing recently, it's been quite a challenge, the College of GPs in Australia puts out a guideline called the Red Book, which are our national preventive care guidelines for GPs. And I've always liked working in the area of prevention, because I think so much good can be done to stave off chronic disease and the impact of disease in people's lives.
Chairing a guideline committee is pretty challenging as well, because guidelines are, you know, they are guidelines rather than rule books, and they get a bit of resistance. Have you had much resistance?
Yeah, I think at various points, you know, people can think that guidelines are not helpful. I think that's been really something that I've tried to address through my work. So on the one hand, I've focused a lot on women's health, but on the other hand, a lot of my work is about developing guidelines that are more useful as summaries of the evidence, of a source of information that that can help in clinical practice. And I focused a lot on implementation and how to make things more implementable, more realistic and more pragmatic, particularly for GPs.
Let's go back a little bit to talk about women's health, because you're very involved in Sphere. Tell us about Sphere.
Yes, so Sphere is a centre of research excellence that I lead, and This is an initiative put out by our National Health and Medical Research Council in Australia, which is the equivalent of the NIHR in the UK and CIHR in Canada. And so the initiative it's a 5-year program of work that you apply for, and its aims are kind of twofold. The first one is to really push the evidence along in that particular area, and you have to justify why the clinical or health service area is of particular significance. But it's also about workforce capacity building and building the next generation of researchers in that space. And so I've been very fortunate. We've had 5 years of funding for Sphere, and we put in an application for another round of funding, and we've just been successful last year. So Sphere is entering now its 6th year, and I've had a fabulous time working with really amazing collaborators, not only in Australia, but also internationally. And I think really helped to push the agenda forward in Australia in women's sexual and reproductive health.
Now, you've attracted an enormous amount of research money. The last figure I saw was 48 million. Perhaps it's more than that. Tell us what the figure is now, and what is your secret?
My secret is having fantastic people that I work with. And I guess nothing comes easily. So Sphere, we got on our 3rd application, and I was always inspired by a colleague who kept putting in a research grant, and the 7th time she put it in, she got it. So I think constant refinement. I think a lot of stakeholder engagement, a lot of really effective partnerships with people, and having a great team that I work with. And grant writing, I was telling my team this morning that when you do grant writing is a craft that you learn, but in general practice, like many other clinical areas, we don't really learn those skills. It's all about writing and communication and making things easily digestible. And so I've learned from the experts and really made it an exercise in vigorous, concise writing with some really good kind of figures and explanations to really engage reviewers. And I think it's also very easy for me to justify the significance of the work that I do. Women's sexual and reproductive health is really quite fundamental to the trajectory of women's lives. And I can make a strong argument about why they should fund me.
Now, you talked about the importance of sexual and reproductive health, but in terms of women's health, I'd like to ask you about an area that's really topical at the moment and a huge challenge to general practice, and that's endometriosis. Where are we going with endometriosis at the moment?
Yeah, so just recently I've taken an increased interest in this area. I think a lot of it because I've been on the National Endometriosis Guideline group in Australia, representing general practice, and I've also just been awarded a large grant to develop and implement an endometriosis and pelvic pain management plan for general practice. So I think there's very high rates of endometriosis in the community, and there's a lot of delay in diagnosis, which leads to a lot of chronic symptomatology in women, and really poor quality of life. And traditionally, a lot of the responsibility for that has been attributed to poor performance in general practice. Or GPs don't pick up endometriosis. GPs don't diagnose it. Poor women, and many women are afflicted by this, long delay in getting an explanation for their symptoms. What really concerns me is a long delay in the management. And I think that's because GPs feel concerned about needing to give a diagnosis to women's presentations that may or may not be endometriosis, but the management of them is readily accessible to us. So I'll give you an example, of a teenage girl who presents with her mum with a very bad period pain. And, they're looking for a solution, and, they may be offered, non-steroidals or the pill, or might go away and think about it, but perhaps don't come back, or perhaps aren't offered what we know can be very effective, which is long-acting reversible contraception, like a progestogen-containing IUD. So I think the earlier we start these kinds of hormonal treatments, it'll be interesting to see longitudinally in cohort studies whether we can actually defray the burden in morbidity that occurs with the onset of endometriosis and it being delayed in diagnosis. My big argument to GPs, or my proposition to GPs, is doesn't matter really whether they've got endometriosis or not. Hormonal contraception is the way to go, and start that early and actually treat their symptoms. Don't wait for a diagnosis, because a diagnosis can only come with laparoscopy, and who knows when they're going to get a laparoscopy.
So we've talked now about clinical practice, and we've talked about research. And another area that you're working in is your involvement with government. That's another huge challenge. Tell us about your work with government.
Yeah, well, that's been a very rewarding part of my work with Sphere, particularly in the last few years, is being able to do research that actually has an impact. And I remember having some discussions with Chris Del Mar, who was also someone who made a very big impression on me early on in my career. He said, oh, you do research and it's like throwing that pebble into the pond and waiting for the ripples to hit the shore. And I thought that was quite frustrating. So I've really made a very big effort with Sphere to have much more of a policy impact with government. And a lot of that is about building relationships with people, and, going to see a minister, pursuing them until they give you half an hour, having their chief of staff on your contact list in your phone, and texting and talking and regular catch-ups with them. And what I've been doing is actually presenting the outcomes of our research, and through our Sphere Coalition, actually presenting solutions to them. So I think politicians are often bombarded with, this is a problem, but they're not actually often given the solution to the problem. And the ways we've been approaching that is by building a coalition of people who are interested in women's sexual and reproductive health, really using the multidisciplinary nature of that coalition to get all of the different perspectives within the healthcare system around what the solution can be, and then building a consensus statement where we're all talking on the same page because we've worked out the solution together. And if we're all offering that to government, it's a much more stronger case. So we've had quite a lot of success in terms of building in government support for telehealth, which was quite novel in sexual and reproductive health care, and other initiatives that we've put forward.
And of course, you've brought your work beyond national level because you work with the UN and the Sustainable Goals.
Yeah, so just more recently, I've been working with the WHO on some areas, particularly in the area of preconception care, where we've been talking about the Australian approach to that and possible solutions. And I think you know, the areas that I work in, which are around improving access to services and women's sexual and reproductive health, are ones that are critical right around the world.
And finally, let me ask you, you've had a lot of awards, national awards, recognition in Australia, but you've written a book and it caught my attention that it's been translated both into Mandarin and Russian. That must have
Yes.
been a bit of a thrill.
Yes, it is. It was a great honour, particularly having it translated and going over to China to launch it. I followed in the footsteps of John Murtagh, who's also been a great mentor for me, and his textbook of general practice had been translated into Chinese, and mine followed. And I travelled to China with John and at the launch, and you know, to be able to have that kind of impact has really been something that I really treasure.
Danielle, you've certainly had an impact. It's been fun chatting to you. Thank you very much for sharing your life and career. Thank you very much indeed.
Thanks so much.